Hi, I am Dr. Julie Brown, Carrick-trained concussion doctor, board-certified chiropractic neurologist. Today, I'm going to talk about laser, hyperbarics, medication, all these things after a concussion. People will ask, oh, is acupuncture good? Is this good? Is that, it depends on what the target is. It depends on when you had the concussion. There are many things that go with it. Now, hyperbaric chamber in particular, I believe insurance-wise, it's really only covered for burns. I don't bill for it, so don't quote me on that, but I'm pretty sure that's all it is. For brain injury, you have to pay out of pocket for a hyperbaric chamber. And it is great. I think hyperbaric is great. The caveat I give, and this would be the same caveat I would give for laser, because laser can be a little more specific on where you're aiming for, but it stimulates the outside of the mitochondria and stimulates all the cells to work, heal, repair, whatever needs to happen. And then medication. There are medications that many of my patients come on MD. I'm like, why are you putting a concussion patient on a medicine? It is a functional problem. There's no medicine for function. All three of these things, they all go back to what part of the brain is working, what's not working, what's compromised. When you have a concussion, there's a inflammatory cascade, and this can make your mitochondria not as efficient. If you go just in a hyperbaric only, for example, sure, you may feel better, you may look better, but that does not mean that you are repairing the specific part that is not working. You can be stimulating or making areas that are already working too well in collaboration with this other area not working well. You can drive that, and it's going to look well for a little bit, but you can have compromise later. You may not be fixing, maybe it's an autonomic, maybe it's a balance between sympathetic, parasympathetic, and you drive this sympathetic more, and you're not fixing the parasympathetic. That can be an issue. So when it comes to hyperbaric and laser in particular, my opinion and philosophy would be to target the areas with the physical exercises that you need to do to stimulate the sensory, the motor, whatever it is, get those better. Then I would personally, what I would do is put someone in a hyperbaric chamber to make those pathways more efficient. But you don't want to push a mitochondria directly with a chemical aspect, especially if that mitochondria is broken. You're not fixing it. You're driving the already efficient mitochondria. So that is more of my opinion. I learned more of that from Dr. Carrick. I'm not going to put words in his mouth, but that's always been his thing. Like, let some of the healing that your body does on its own happen. Don't drive systems that you shouldn't drive, because you can create problems in people. Same goes with medication. What is the other thing? Laser, hyperbaric. Oh, the other thing with hyperbaric is it helps with oxygen to rescue. One thing that I do with my patients is I do recommend a ketogenic diet. You can take exogenous ketones, and those are not going to drive certain areas. They do rescue more of that mitochondria. So when you are doing a hyperbaric, I think doing something that stimulates your ketones, whether maybe you're taking ketone salts or ketone acids or some MCT oil to make ketones, I think those would all be wise things to do if you're going in a hyperbaric. As a common suggestion I give my concussion patients. That being said, this is not medical advice. I have not seen you. Don't take this as you should go do that. But these are common things that happen in my practice. If you have any comments and would like to share below, please do. Otherwise, we'll see you when I make another video. Bye.